The Patient Engagement Studio, or PES, was founded in February 2016 with the goal of being more inclusive of patients and community stakeholders in research studies by providing a process for formal patient involvement in research endeavors and clinical innovations. Over the last 7 years, the PES has successfully engaged with patients in South Carolina and surrounding southern states on a wide variety of conditions including breast cancer, rheumatoid arthritis, and diabetes. Due to the unpredictability, newness, and surge in research of COVID-19, we identified a need for a COVID-19 patient panel. Some patients who contract COVID-19 continue to experience symptoms months after the 2-week expected recovery mark from COVID-19 illness. Often referred to as long COVID, these symptoms can include fatigue, shortness of breath, fevers, sleep disorders, and depression amongst others, and may range from mild to severe. To address the long-term effects of COVID-19, the COVID-19-focused Virtual Patient Engagement Studio, or CoVIP Studio, engaged diverse stakeholders in COVID-19 research, with special focus on long-term effects of long COVID. The CoVIP Studio builds on the lessons learned and success of the PCORI-funded Virtual Patient Engagement Studio, or VIP Studio, to support patient-centered outcomes research, PCOR, or clinical effectiveness research, CER, researchers and stakeholders across all 4 geographic regions of the U.S. the Northeast, Midwest, South and West. Flyers were disseminated through social media, email, and other channels to recruit individuals who are experiencing long COVID. After a series of informational sessions, interested individuals were asked to fill out an application to join the CoVIP Studio. We also aimed to have diversity in gender, race, age, and experience. Overall, we had 45 people apply to be a part of the CoVIP Studio. We chose 15 candidates to join the project as CoVIP patient experts. The 15 selected patient experts then attended 8 virtual training sessions with the primary goal of building trust among the group. During these sessions, patients, caregivers, clinicians, and researchers on the CoVIP Studio engaged in a bidirectional co-learning environment. This time spent in training prepared patient experts to share their stories in a way that would bolster PCOR, CER research. 20 CoVIP Studio sessions for CER, PCOR projects were conducted over the course of 6 months. Over that time, our patient experts engaged with 30 researchers from institutions all over the country. This was a significant advancement for the Patient Engagement Studio, with 75% of sessions involving researchers outside of USC, and 55% of sessions involving researchers outside of South Carolina. More importantly, these sessions provided space for patient experts to provide invaluable feedback on research from proposal, participant recruitment, outcome measures and dissemination of results. Since the beginning of the COVID-19 pandemic, patients themselves had to fight to be heard from the medical community that their symptoms were not going away. They are continuing to fight to keep the spotlight on the very real struggles that continue over 3 years since the pandemic began. We have shown that this type of virtual engagement of patients in research is not only possible, but highly effective in providing researchers with meaningful feedback to improve studies and place patient-centered outcomes at the forefront.